Night saw the expansion of a new nighttime vaccination drive set for 10 cities now across the country. Hundreds of people remain lined up into the early morning hours for the third vaccine booster shot, now approved for those 50 and older. The initiative also aims to vaccinate younger adult residents who some have not yet received any dose of the vaccine. Now, at least 5,800 new cases of the virus were detected across Israel going into the weekend. Now we go to our correspondent, Ariel Levine-Waldman, who's out at a vaccination center in Holon. Ariel, vaccines, at least from the authority figures, still seen as the solution to this fourth wave that has been so persistent, yet these numbers haven't been reduced yet. What's the status?
Well, the status is one of two things. You're looking at two major numbers, infectivity versus hospitalization rate. And the proof for vaccination comes down to the numbers. Look at the groups above the age of 60 years. If you look at these groups, people that are unvaccinated are seeing hospitalization rates of about 120 in 100,000. That's a pretty significant number, epidemiologically speaking. If you look at people who are fully vaccinated, that's actually 19 in 100,000, or 1/6 the rate when we're looking at the critical demographic that's most likely to be hospitalized. So the government is seeing the vaccines as the solution because at the moment they do seem to be working to suppress the worst breakouts of the disease and the worst morbidity factors associated with the disease. Now, you break that down into what the next step is. The government is more or less flip-flopping on whether or not to bring down the age of vaccination from 50 now to 40 now, and they're getting some pushback from other ministries at the moment, but there's a big discussion to be had right now, because if you look at Israel, it's not just the first in the world to be doing this, it's only one of the only nations in the world to actually approve of a third vaccination dosage. We've seen some European nations, we've seen England, we've seen Germany talk about starting a third dose in September. Israel's the only one to do it, and that's because many of the World Health Organizations and organizations like the Food and Drug Administration are not really aboard the plan. I want to see more research coming out first. But the data seems to suggest that it is working, and that's behind Israel's push to try to get as many people vaccinated with a third dose as possible.
And the status of the hospitals, Ariel, they're still holding together, not overwhelmed yet?
Not quite yet, but the numbers are rising. We are seeing some numbers upwards of 800, 850 people in serious condition as of the data from last night. That's pretty significant because the hospitals are saying once they reach about 1,000, they start to see their wards fill up. And we're hearing reports that patients are being transferred from the periphery suburbs of Tel Aviv into Tel Aviv proper because of that.